Live, ma'am. Sorry, ma'am.
That's
Good evening, everyone. Myself Srinidhi from a third professional BA MS. I'm from Sri Kalaperiveshwara Swami Ayurvedic Medical College, Bengaluru. It gives me immense pleasure to welcome you all to this session of Pragnavaridhi, a lecture series on KAYACHIKITSA Paper 1 Part B, curated specially as a comprehensive revision aid for fourth year BAMS students. Today, we are honored to have with us Dr. Sindhura ma'am, a highly respected teacher, clinician, and an academician in the field of Ayurveda. Welcome, ma'am. Here is a short introduction about ma'am.
Thank you.
Ma'am is currently working as an associate professor, Department of Kayachikitsa, SKAMC Hospital and Research Center, Bengaluru. Has completed BAMS from SDM College of Ayurveda, Udupi. MD in Kayachikitsa from Government Ayurveda Medical College and Hospital, Mysore. Pursuing PhD from Rajiv Gandhi University of Health Sciences Center, SKMC HNRC, Bengaluru. Ma'am also holds a master's degree in astrology, has published over 20 plus publications so far, and also authored a chapter in textbook of Kaya Chikitsa. I take pleasure to give a brief introduction about you, ma'am. Thank you so much. I hand over the
Thank
session
you.
to you, ma'am.
Yeah, sure. I'm starting with the session now. Thank you for the introduction. So, there are few of the topics like I'm dealing with Kai Chikitsa paper 1 part B, as Srinidhi was telling. And in that topic, let me deal with few of the topics or few of the chikitsas that is very important to you. So among that, if you can visualize the screen, the first thing is that I'm starting with Pandu as well as the Kamala chikitsa. Okay, hope the screen is visible. So first coming to what is called as the Pandu here. So Pandu is the disease where you can diagnose the disease without being even going for the this other examinations like Panyate, Jayate, Katanam Vina Api. Without going for the history taking itself, by looking into the patient itself, you can know about the Pandu or you get the diagnosis of Pandu. So moving on to the chikitsa of the Pandu. So here, first let us go for the Samprapti Vigatana. Here the Samprapti said in Pandu according to the Charaka Chikitsa 12th chapter as Samudiranam Yada Pittam Hridaye Samavastitam Vayuna Balina Kshiptam Samprapyaha Damanirdashaha Prapannam Kevalam Deham Tvak Mamsantaram Pradushya Kafavatasrak Tvak Mamsani Korode Tat. So, in any disease, for the easy understanding, we'll go for the Samprapti Vigatana. So, what is Samprapti Vigatana? According to the Samprapti, what is the first measure, what is the first chikitsa that you have to adopt in the patient in case of the Pandu roga? And this will follow. Like, for example, what happens in this Pandu? Nidana Sevana will aggravate the Pitta dosha, and this Pitta dosha, this will be circulated in the body and there will be the Hridaya Prapti of the vitiated Pitta. On the other hand, what happens? The Rakta Poshaka above of the Rasadhatu will be found. That means the patient will be taking the food in adequate quantity, whereas the poshaka amsha in the rasadhatu, which will nourish the raktadhatu, will be absent there or that will be abhava there. So that will lead to the decreased formation of rakta, and there will be the circulation of pitta to the whole body by the vyana vayu through the rasadhamanis, and that will lead to the this location of the vitiated pitta in between the skin and Mamsa Twak Mamsantara Mashitaha, and that will lead to the vitiation of the Kapha, Asrit, Twak, and Mamsa, leading to the Pratyatma Lakshanas of Pandu. So the first thing is, in every disease, the Nidana Parivarchana becomes important. As per Shushruta Uttara saying that Sankshepatha Kriya Yogo Nidana Parivarchana. So first, educate the patient to avoid all the nidanas that is leading to the Panduroga, and then considering this phase as a sanchaya and prakopa avastha, so the lakshanas that is seen in sanchaya avastha is chaya karana vidvesha and viparita guna icha. The person will be having the inclination towards the food articles which is opposite to the guna of the disease, opposite to the guna of the hetus. So fulfill the same, and then when there is a decreased formation of Rakta, go for the Swayoni Vardhana Chikitsa. And in the Prasaravas and in the Sthana Samshayavastha, go for this Sroto Dushti Chikitsas, and then go for the Vyadhi Pratinika Chikitsa. So this is the Chikitsa Sutra of the Panduroga. Tatra Panduvamayi Snigdha Tikshnaihi Urdhva Anulomikaihi Samshodhyo Mrudubihi Tiktaihi Kamalitu Virechanahi. So this is the Chikitsa Sutra of the Panduroga. Tatra Panduvamayi. In case of the Panduroga, go for the Snigdaihi Tikshnaihi Urdhva Anulomikaihi. And then after the Shodhana, Samshodhyo Mrudubhi Tiktaihi Kamalitu Virechanahi. That follows the Sutra of Kamala. So let's see how to go for the Shodhana Chikitsa in case of the Panduroga. So then in the Chikitsa Sutra it is said the Snehapana should be done with Panchagavya or Kalyanaka Grita. So Jalhana says that commenting on the Sneha says that in case of the Panduroga, Grita is ideal for the Snehapana. So Snigdaihi Tikshnaihi Urdhvaihi Anulomikaihi Urdhva Anulomikaihi. This is the Chikitsa Sutra that is said for the Panduroga. So first you have to go for the Shodhana line of treatment, and for going to the Shodhana line of treatment, what are the protocols? See, in all the diseases we go for this Snehapana. And then after the Snehapana, we go for the Vishramakala, and during the Vishramakala, we go for the Snehana, Bahya Snehana as well as this Vedana, and then we go for the Urdhva Anulomika, the Shodhana Chikitsa. So here, the Snehapana is the first thing. Here the Snehapana we adopt in case of as the Arohana Snehapana. So what has to be, what Sneha has to be selected for the Snehapana? It is the Grita itself. As per Shushrita Uttara, he says, Pandurogeshu Griteneva Sneha Muktam. You have to give the Snehapana with Grita itself. That says that the Taila is a contraindication. Tattesha Pitta Bhuishtatvat Rakta Dushayatvat. As because where the pathology is because of the Pitta dosha and the dosha is Rakta, so Grita is ideal and not the Taila. So what you are going to select here? The Panchagavya or Kalyanaka Grita. Panchagavya Mahatiktam Kalyanakam Atapiva. That is what the Chikitsa Sutra says. So Snehapana with Panchagavya or Kalyanaka Grita, and that will be a Shodhana Purva Snehapana. So here it is said that Arunadatta substantiates the use of Grita in Panduroga as Asmin Vyadau Pradhanyena Pitta Chikitsa Karyaha Tadanavata Kafayoho. So here, as it is a Pittaja condition here, so Pitta Chikitsa Karya is ideal. So that is why you have to go for the Grita for the Snehapana, not the Taila. So here Snehana should be given as Shodhana Purva Sneha. So as it is a Shodhana Purva Sneha, we go in the Arohana Krama, in the increasing dosage. And after that, here as like any other diseases, after Snehana, Svedana is not adopted. Okay, we go for the Snehana and then the Virechana is advised. So what Virechana can be advised with a Draksha or Kashmiri soaked in Danti Falakwata. This is the Virechana drug. And after Virechana, then Samsarjana Krama is advised for in the Chikitsa Sutra as Tabhyam Samshuddha Koshtabhyam. After during the Samshodhana, Tabhyam Samshuddha Koshtabhyam, after the Shodhana Karma, Patya Annani Dhapayet. You have to advise for the Patya Annas. Shalin Sayava Goduman, Purana Yusha Samhitan, Mudga Adaki Masuraishcha Jangalaishcha Rasaihita. So that says that here when you see in case of the Kamala also, in case of the Kamala, we do not advise the patient to take for the fat food, the fat rich food. So this is the combination. Shalin Sayava Goduman Purana Nyusha Samhitan Mudga Adake Masuraishcha Jangalaishcha Rasaihita. That means here it is having the predominant of the carbohydrate and then the protein, whereas the fat is nil. So that idea, this food will be ideal in the patient. And then the ingredient, this few of the formulations like Navayasaloha having the ingredient of loha basma, vidanga, trifala, trikatu, and musta. So whatever the combination or whatever the formulations that you see in case of the Pandu will be having this combination. If you observe very clearly, that will be having Pandu formulation. The formulation for Pandu will be having a compound which can supplement the iron, like the ferrous compound. Loha Basma. Loha Basma is a direct supplementation of the ferrous compound. The ferrous compound which helps in the maturation of RBC in iron deficiency anemia, and then it will be having a drug called Krimihara drug. Okay, and anti-helminthic drug, that is Bidanga, and then it will be having a Trifala wherein Amalaki, which is rich in vitamin C, which helps in the absorption of the iron, and then Trikatu and Musta, a very good appetizer and digestive. So whatever the formulations that you get in case of the Pandu roga will be having these combination, that is a ferrous compound which helps in the maturation of the RBC, and then a drug for Krimihara, and then a drug Amalaka which helps in the absorption of the iron, and Trikatu which is a good appetizer and digestive. And then in case of the Pittacha Pandu also, the treatment protocol will be same. The Snehana, here you can go for the Mahatiktaka Grita, Katukadya Grita or Draksha Grita for Snehana, and then Virechana Vetrivrit Churna added with twice the quantity of sugar. The procedure is same, where we are selecting a different Grita for this Snehapana, which is usually the Pitta Hara Grita we can select. And here Yogaraja will be the best medicine, having these many ingredients. And in case of the Kafaja Pandu also, we go for the Snehapana and then the Virechana. Snehapana can be done with Dantigrata and Patyagrata. It is mainly indicated for Kafaja Pandu. And then Virechana here can be done with Haritaki soaked in Gomutra. Again, it is exclusively for the Kafaja Pandu Chikitsa. So Punarnava Mandura, again, it is the best choice here. And then next coming to the Mrid Bhakshanajanya Panduroga. So you have heard about the Pica syndrome, where the Pica syndrome is a condition where the patient develops the anemia because of the consumption of the non-nutritive food articles. So because of the consumption of the Kashaya, Mrit, the Vata will get aggravated. Because of consumption of the Ushara, the Pitta will get aggravated. And because of the consumption of Madhura, Mrit, the Kapha will get aggravated. So what happens here? This undigested Mrit, which will block the channels of the Rasavahasrotas, and because of the blocking of the Rasavahasrotas, the successive dhatus will not be formed, and then there will be the manifestation of Panduroga. See, here the pathology is that there will be a blockage in the channels of the Rasavahasrotas. So that is why the treatment will be, you have to adopt for the Tikshna Shodhana line of management, as there is blockage in the Srotas. So obviously the Nidhana Parivarjana is the first line of treatment. So let's see what is the Chikitsa Sutra in case of the Mrit Bhakshanajanya Pandu. Yuktignaha Shodhanaihi Tikshnaihi Prasamikshya Bala Abalam Shuddhakayasya Sarpishi Baladanani Yojayat. So this is more important, Yuktignaha. So what do you have to plan? Shodhanaihi Tikshnahi. The Shodhana has to be adopted. So how should be the Shodhana? It should be Tikshna Shodhana. Prasamikshya Bala Balam. So before advising for Shodhana, you have to assess the Bala of the patient. And then after advising the Shodhana Chikitsa, Shuddha Kayasya, that says after the Shodhana, once the Sharira has undergone the purification or purificatory measures, Sarpishahi Baladanani Yojayet. Obviously, after the Shodhana, the person would have ended up in reduced Bala. That is why you have to advise for Sarpi Prayoga after the Shodhana to gain or regain the strength in the patient. This is what the Chikitsa Sutra says. So, Yuktignaha Shodhanaihi Tikshnahi. Let's adopt the Tikshna Shodhana. So, Tikshna Shodhana can be advised with Snuhik Shira Adibihi. The Snuhik Shira can be advised. And after the Tikshna Shodhana, you have to advise the Sarpi Prayoga in the patient. So Sarpi Prayoga again, you can go for the Vyoshyadyagrita or Naga Kesaragrita. This is again saying that in case of the Vyoshyadyagrita as well as the Naga Kesaragrita, there is a combination where it contains vitamin C, that is the amalake, which will help in the absorption of the iron. And also it contains a drug which is Krimihara, maybe a Pipali or this Naga Kesara, that will have a drug which is Krimihara. So, and also it has the iron supplements like, for example, Ayoraja. So this combination can be given. So in case of the Mridbhakshanajanya Pandu, you are treating the patient with Shodhana, that is Tikshna Shodhana, and after the Tikshna Shodhana, go for the Sarpi Prayoga to enhance the Bala in the individual. And then one more thing is we have the reference of de-addiction of the habit of eating pitta. Why? Because we are treating the pitta syndrome. So the patient has to be made aversion towards the pittas. So Mrid Bhakshanat Aturasya Laulyat Vinivartan. This is called as Aturasya Laulyat Vinivartanaha. Vinivartinaha. That is de-addiction of habit of eating the pitta. So Dveshartam Bhavitam Kamam Dadyat Taddoshanashanehi. So what we have to do here with all these drugs, Vidanga, Ela, Ativisha, Nimba Patrena, Pataya, Vartakaihi, Katarohinyaha, Kautachaihi Murvaya Apiva. So the breath has to be done bhavana, it has to be mixed with all these drugs, which are mainly Krimihara, then that has to be advised to the patient for the de-addiction of the habit of eating pitta. So this completes the treatments of Mridbhakshanajanya Pandu. And next is Kamala. So Kamala here is Pandurogi tuyo atyartam pittalani nishevate. In case of the Pandurogi, if a patient during the convulsion period of the Pandurogi, if he has not maintained the diet properly, or if he has still underwent for the Pittala Ahara Viharas, he'll end up in the Kamala Roga. So this is the Nidanarthakara Roga, that is Pandu leading to the Kamala. And more importantly, remember that only the Pittaja Pandu will lead to the Kamala Roga. Okay, that is only the hemolytic anemia will lead to the hemolytic jaundice. That is Pittaja Pandu will lead to the Pittaja Kamala. So here, it is not only Pandurogante apicha, that is the Pittaja Pandu reading during the convulsant period of the Pittaja Pandu. If the patient consumes more of the Pittakara Ahara Vihara like Madhyapana or Amla Ahara, there will be Sahasa production of the Ranjaka Pitta, that is bilirubin, and that will cause the visheshan of Ranjaka Pitta. Ranjaka Pitta burns the blood and flesh, that is Asrak Mamsang Dadva Rogaya Kalpate. There can be other reasons also. In some cases like Anya Rogante Apicha, that is the Kamala can also manifest because of some other diseases. It need not be Pittaja Pandu alone. It can be secondary to the some other diseases, like maybe they are speaking about the snake bite, or they are speaking about the malarias, or Pandurogad Vina Api Babet. It need not happen only secondary to the Panduroga. It can happen without the existence of the Panduroga. Maybe he is speaking about prolonged starvation or hepatotoxic drugs. These are the reasons. One, because of the Panduroga, if he consumes the Pittakara Ahara Vihara during convulsion period, and the second one is Anya Rogante Apicha, and third one is Pandurogad Vina Api Bhavet. So here, when you see the chikitsa, this is the chikitsa sutra, Kamalayantu Pittagnam Pandu Roga Avirodhiyat. That is Kamalayantu Pittagnam. Let's study this Kamalayantu Pittagnam. So, in case of the Kamala Chikitsa, to eliminate the Ranjaka Pitta, which is elevated in the blood, Pittagna drugs are used. And these Pittagna drugs, if you are using, it should be Panduroga Avirodhiyat. That is, the drugs which is used in the kushta Shakashritha Kamala should not cause adverse effect on the Panduroga. Why? Because the Panduroga here It is because the Pandaroga, which is manifest, Pandaroga has led to the Kamala Roga. So when you are treating the Kamala Roga, you need a drug which is Pittagna. You need a drug which is Pittagna. And at the same time, see that it is not opposite to that of the Pandaroga. That is Kamalayant Pittagnam Pandu Roga Avirodhi Yat. So to eliminate the Ranjaka Pitta, which is elevated in the blood, that is to decrease the bilirubin, the Pittagna drugs are used. So when you are treating the Kamala, see that in case of the Kosta Shakashritha Kamala, it will not show the adverse effect on the Pandaroga. So here Snehapana followed by Virechana is advised. Mrudubihi Tiktakaihi Kamaletu Virechanahi. This is what the Chikitsa Sutra says. So go for the Snehapana. Snehapana can be given with Panchagavyam Mahatiktam Kalyanakam Matapiva, Panchagavya Grita or Kalyanaka Grita or Mahatiktaka Grita. And then go for the Virechana. That is Mrudu Virechana can be given here. Mrudu Virechana, Mrudubihi Tiktakaihi Kamalitu Virechanahi. So Mrudu Virechana with Tiktaka Dravyas can be advised in case of the Kamala Roga. So Virechana can be advised with Gomutra and Godugdha that are mixed together, or Danti Falakvata and Kashmiri Falakvata can be advised, or Trivrit Churna can be given, which is mixed with the sugar as per the Chikitsa Sutra. Main thing is Mrudubihi Kamal Tiktakaihi Kamalitu Virechanahi. So if you have to advise for the Virechana in case of the Kamala. So if you are advising for Virechana in Kamala, the Virechana drugs should be Mrudu and Tikta Dravyas. And the Chikitsa Sutra here. So this is the Chikitsa Sutra from Chakradatta for the Kamala, saying that Rechanam Kamalartasya Snigdasya Adau Prayojayet Manaha Prashamani Karya Kriya Vaidyena Janata. Rechana Kamalartasya. Rechana in the sense you have to go for the Virechana line of management. That means after this Snehapana in the Arohana Krama, you have to go for the Rechana line of management. Snigdasya Adau Prayojayet. And after Rechana, that is Mrudu Virechana with Trikta Dravyas, go for the Prashamana Chikitsa. And then go for the Raktavardhaka Chikitsa and Patya Apatyas. And then again the Samsarjana Krama, the same Samsarjana Krama to be followed as per the Chikitsa Sutra. Tabhyam Samshuddha Koshtabhyam Patya Annanidapayet Shali Savyava Goduman Purana Nyusha Samhitan Mudga Adaki Masureshcha Jangalesha Rasehita. That is the component carbohydrate as well as the protein should be like this in this percentage. It should be nil of the fat. That is what the Chikitsa Sutra says. So these are the Shamanaushadis you can give in case of the Kamala Roga. So this is about the Koshta Shakashritha Kamala, and next coming to the Shakashritha Kamala. So here what happens in case of the Shakashritha Kamala is because of the Nidanas. Nidanas here is it is having its own Nidana. Maybe Rukshahara, Guru, Shita, Swadu Ahara. Because of the Nidanas, there will be the vitiation of the Vata and Kapha, and this aggravates the Kapha. This aggravated Kapha obstructs the channels of the Ranjaka Pitta. So, and following that, the Ranjaka Pitta cannot be is not able to flow to the Koshta, which is where it is expected to flow normally. Okay, so what happens here? Because of the Vata as well as the Kapha, the vitiated Vata and Kapha, the aggravated Kapha obstructs the channels of the Ranjaka Pitta. It will block the channel of the bile. So the Ranjaka Pitta, that is the bile, should flow into the Koshta, that is duodenum, which is where it is expected to flow normally. Here, because of the obstruction, this will not be, the bile or the Ranjaka Pitta will not be flowing into the Koshta, that is duodenum. So there is absence of Ranjaka Pitta in the Koshta. So because of the absence of Ranjaka Pitta in the Koshta, the food will remain undigested because of the absence of the bile salts and the bile pigments in the koshta, that will not be able to digest the food. So because of that, the fat content in the food will not be digested because of the absence of the bile salts and the bile pigments in the koshta. So that is why the fat will remain undigested. So as the fat remains undigested, the purisha doesn't get the color or gets the color of the tila pishta niva varchas, that is said in case of the Shakashritha Kamala. As the food remain undigested in absence of the bile salts and the bile pigments. Why? Because there is obstruction to the flow of the bile salts and bile pigments to the duodenum. The food will not get digested. That is why the stool gets the color of the tila pishta neba varchas. It will resemble like that of the tila pishta. The color as well as the sliminess, the texture will be compared to that of the tila pishta neba. So what is the pathology here? The pathology is there is obstruction to the flow of the bile salts and the bile pigments. So that is why we have to remove the obstruction. The treatment protocol will be to remove the obstruction. Kafahara Pitta Vriddhikara Chikitsa to be adopted. Then we'll see how to go for the treatment. So the Shakashritha Kamala Chikitsa says that Tila Pishtanibam Yastu Varchaha Srijati Kamali Shleshmana Rundya Margam Tat Pittam Kafaharaihi Jayed. So there will be Tila Pishtaniva Varchas. When Tila Pishtaniva Varchas is present in the patient, that indicates that there is no bile salts and bile pigments that is being secreted into the duodenum to digest the fat. So that is why the patient is having Tila Pishtaniva Varchas. So it indicates the obstruction of Raktapitta due to the kapha dosha. So that is why our treatment should aim at removing the obstruction of Raktapitta, obstruction to the Raktapitta by kapha dosha. So what we are going here, Shleshmana Rundya Margam Tat Pittam Kafaharaihi Jayed. So we have to go for the Tat Pittam Kafaharaihi Jayed. So the removal of the kapha dosha which is situated in the Pitta Sthana. So to remove the kapha dosha which is situated in the Pitta Sthana, we should go for the drugs like Katu, Amla, Lavana Rasa with Tikshna, Ushna and Ruksha properties. Advising these drugs will help in removal of the kapha dosha. So these are the drugs which will help to remove the kapha dosha in the Pitta Sthana. And then Kafaharam Pitta Vriddhikaram Samam Chikisitam Shakashaya Doshasya Vriddhihi Koshta Nayanartham. So increase the Ranjaka Pitta at the level of Shaka to bring it to Koshta. So here Ruksha, Ushna, Katu, Tikshna drugs should be taken internally, which increases the Ranjaka Pitta and is excreted into the Koshta. So and then see here we are doing the Kafahara Pitta Vriddhikara Samam Chikisitam. That is Pitta Vriddhi we are doing and Kafahara Chikitsa we are adopting here. Kafaharam Pitta Vriddhikaram Samam Chikisitam. The pathology is the Pitta is not being flowing into the duodenum. That is the bile salts and bile pigments are not allowed to flow into the duodenum because of the obstruction by the kapha dosha. So we have to go for the Kafahara Pitta Vriddhikara Chikitsa here. So for that we are advising with all the drugs which will decrease or which will remove the kapha dosha and that will increase the pitta dosha. So the next question is, till when this particular treatment has to be given to the patient? Till when you have to go for the Kafahara Pitta Vriddhikara Chikitsa in case of the Shakashritha Kamala? The answer is Shakashraya Pittam Swayam Amashayam Etiyati. That means the above said procedure, that is Kafahara Pitta Vriddhikara Chikitsa, to be followed until the Shakagata Ranjaka Pitta returns to its koshta. until the Shakagata Ranjaka Pitta returns to its koshta, until the bile salts and bile pigments will flow into the duodenum. Okay, so the next question is how to understand the Ranjaka Pitta that has reached the koshta or Somayasha. It is said that till the Shakagata Ranjaka Pitta returns to its koshta, that is its own locations for Amashaya, till then you have to continue the Kafahara Pitta Vriddhikara Chikitsa. How to understand that the Ranjaka Pitta has reached the koshta or Somayasha is that Apitta ragat shakruto. We have studied in the pathology saying that there is a tilapishthaniva varchas because of the obstruction of to the bile salts and bile pigments. So here, till the stools get the normal color, apitta ragat shakruto. Yavat koshta margasto malo naranjate tavat pitta vardhanam. So till the purisha gets the normal color, go for the same line of treatment. Once the stool attains the normal color, it is understood that the obstruction is relieved. Okay, till then go for the Kafahara Pitta Vriddhikara Chikitsa. Once the stools or once the Purisha gets the normal color, and then you can treat the Kafahara Pitta Vriddhikara Chikitsa and then follow the Koshta Shakashritha Kamala Chikitsa, which is explained previously. So this is about the treatment for Koshta Shakashritha as well as the Shakashritha Kamala Chikitsa. And Kumbha Kamala, you can go for the Swarnamakshika Basma and Shuddha Shilajidhu. This is usually advised for the Kumbha Kamala, and for Halimaka, go for the Snehapana, that is Shodhana Purva Snehapana in Arohana Krama, and then Virechana, and then Shamana Oshadhi, and Basti is also mentioned in case of the Halimaka as Yapana Basti, Kshira Basti, and Anvasana Basti. And then, yeah, this is about the Pandu Kamala Chikitsa. And next, moving to Jwara. Yeah, Jwara Chikitsa. See here, when you study the Jwara Chikitsa, when you study the Jwara Chikitsa, it is very important to go in sequence. It is important to go in sequence. There is a sequence for the Jwara. First, go for the first phase of the Jwara, that is called as the Taruna Jwara Chikitsa. And then it is the after Taruna Jwara, it is called as the Jeerna Jwara, and then the treatment of the Purana Jwara. There is a sequence for the Jwara. So in the initial stage, that is called as the Taruna Jwara, the Chikitsa Sutra set is Jware Langana Mevadav. That is, go for the Langana. First you go for the Langana Chikitsa. What is Langana here? Langana Shabdena Anashana Vivakshitaha. Fasting. Langana is fasting. According to Chakrapani, Jware Langana Mevadav. Langana is the first line of treatment. So what is Langana here? Langana Shabdena Anashana Vivakshitaha. That is, Langana here is fasting. So, Langana is fasting, and you can also advise Vamana when there is aggravation of Pitta Shleshma. So, Taruna Jwara, here the first line of treatment is Langana, and Langana is indicated only in case if it is a Sama Jwara. In case of Sama Jwara, and also in case of the Kafaja Jwara, in case of the Kafa Pittaja Jwara, and in case of the Samavata Jwara, there is an indication for Langana. In other cases, Langana is a contraindication. Okay, like contraindication in Vata Jwara. Same Vata Jwara, if you see, in case of the Samavata Jwara, Langana is indicated. In case of the Niramavata Jwara, Langana is a contraindication. There is a list of contraindication, that is Vata Jwara. In case of the Shramaja Jwara, you should not go for the Langana Chikitsa. And then in case of the Purana Jwara, Kshataja Jwara, Langanam Nahitam Vidyat Shamanaistan Upacharet. In these cases, that is Vataja Jwara, Shamaja Jwara, Purana Jwara, Kshataja Jwara, do not go for the Langana. Instead, go for the Shamana Chikitsa alone. And also in case of the Kshayaja Jwara, Nirama Anila Jwara, and the Jwara which is caused by Bhaya, Krodha, Shoka, Shamodbhavat, do not go for the Langana Chikitsa. Otherwise, Langana is the first choice. Langanam, Swedanam, Kalo, Yavagu, Tiktakorasaha, Pachanani Abhipakvanam Doshanam Tarunejware. This is the Chikitsa Sutra of Tarunajwara. Langana, that is fasting. Svedana, again Svedana line of management. Kala here refers to the time factor. Kala here refers to the time factor or the passage of the time. Yavagu, and also different types of Yavagu is said. Yavagu Tiktako Rasaha. Yavagu, which is prepared mainly of the Tikta Rasas. Pachanani avipakvanam doshanam tarunejware. So the main intention is to go for the pachana of the avipakva doshas. So that is why these treatment are advised. Pachanani for the purpose of pachana of the avipakva doshas in case of the tarunajwara. All this treatment is indicated. And in case of the Tarunajwara, if the patient is suffering from Trishna, you can advise Ushna Jala in case if it is a Vata Kaphaja Jwara. In case if it is a Madhyota Jwara, if it is because of the consumption of Madhya, or in case of the Pittaja Jwara, then if the patient is suffering from Trishna, you can go for the Shitala Jala or the Jala which is processed with the Tikta Dravyas. And also you have the reference of Shadanga Pani, Musta Parpataka Ushira, Chandana Udichya Nagarai, Shruta Shitam Jalam Deyam Pipasa Jwara Shante. You can also advise the Shadanga Pani. Next is Vamana. When to go for the Vamana in case of the Jwara? You can advise the Vamana on 6th day. And to advise Vamana in Jwara, there is some criteria. The criteria are Kapha Pradhanan, Utklishtan, Doshanam Amashaya Sthitan, Buddhva Jwarakaran Kale, Vamyanam Vamanaihi Harit. Kapha Pradhana Jwara, Utklishtan, the dosha should be in Utklishta Avastha and it should be in the Amashaya. Doshanam Amashaya Sthitam, it should be in the Amashaya. Buddhva Jwarakaran Kale, Vamyanam Vamanaihi Harit. So you can advise for Vamana if the Jwara has all these Lakshanas. And remember, here, before giving the Vamana, Sneha Svedana is not done. Okay? That is, Snehana is not advised, Vedana is not advised. Directly go for the Vamana, that is Ullekana line of management. The next is, with what should you advise the Vamana? There is a shloka in 220. That is why here, no, in case of the Jwara, the shlokas are actually scattered. Okay, so this chart is given for you, the sequence is given to you for the easy understanding. So Vamana can be advised with Madana Phala Pippali in case of Vataja Jwara. In case of Pittaja Jwara, go for Kalinga Kaihi. In case of Kaphaja Jwara, Madhukena. The Madhukena can be used. Or you can advise to Vamana with Ushnambu or Kshirambu or Lavanambu or Ikshurasambu. So it is very mandatory to go for the Vamana if the patient fulfills this condition. Kapha Pradhanan Utklishtan, Doshanam Amashay Sthitan, Buddhva Jwarakaran Kale, Vamyanam Vamanaihi Hare. If the above condition is not fulfilled, the patient will end up in Hridroga, Shwasa, Anaha and Moha. So after Vamana, Manda is advised to the patient. After Manda, Yavagupana is advised. Okay, after Manda, Yavagupana is advised. So Yavagupana is having very important role in case of the Jwara, saying that Yavagupana does Agnidipana. Because of Beshaja Samyogat Lagutvat, because of the medicine which is present in the Yavagu, it does the Agnidipana. And the second point is Vata Mutra Purisha Anulomana. It does the Yavagupana does Vata Mutra Purisha Anulomana. And because of Drava Guna of the Yavagu and because of the Ushna guna of the Yavagu, it does Vedaniya, it is Vedaniya. And because of the Dravatvat, it is again Trit Prashamaniya. It relieves the thirst in the patient. Because of the Dravatvat, it is Trit Prashamaniya. And Saratvat Lagavascha. It is Lagu for digestion, and it is Pranaya also. It is Pranaya. As it is Ahara Bhava, the Yavagu is Ahara. Okay, then as it is Ahara Bhava, it is Pranaya to the patient. So Yavagu does all this job. Yavagu is Agnidipana, Yavagu does Anulomana, Yavagu does Vedana, Yavagu does Trit Prashamana, and Yavagu is Lagu, and it is Jwaragna, and it is Pranaya. So Yavagu should be given in Annadana Kala. Whenever the patient is hungry, during the Annadana Kala, whenever it is lunch time, whenever it is dinner time, go for the Yavagu Prayoga. And with what the Yavagu should be prepared, the same as that of the Shadangapaniya. The drugs which is used for the Shadangapaniya can be used for Yavagu. So this Yavagu should be given for 6 days. And again, Yavagu is having certain contraindication like Madatyaye, Madhyanitye, Grishme, Pitta Kafadike. In Madatyaya, you should not go for the Yavagu. In case of Madhyanitya, again it is a contraindication. In case of the Grishma Ritu, again it is a contraindication. And in case of the Pitta Kafadika, it is contraindication. And also in case of the Urdhvaga Raktapitta, it is contraindication. Chayavagu, Nahita Jwara. These are the list where the Yavagu is a contraindication. Instead, in this, you can go for the Tarpana. Okay, Tarpana Mevagre Laja Saktubihi. Laja Saktu Tarpana can be advised, which is mixed with the Phala and Madhu as well as the Sharkara can be advised. Well, you have given the Manda, you have given the Yavagu, and then the Danta Davana should be advised in the patient. That is Asya Prakshalana. After that, you should assess the Bala in the patient. Satmya Bala Avekshya. If still, after the Satmya Bala Avekshya, if still the patient is having Durbal Agni, give Yusha. If patient is having the adequate Bala, then go for the Mamsarasa. Mudga Yushena Jangalanam Rasenava. You should go for the Mudga Yusha Prayoga, or you should go for the Jangalana Mamsarasa. If the patient is having Durbalagni, go for Yusha Prayoga. If the patient is having the normal Agni, go for the Jangala Mamsa Prayoga. And after that, for 10 days, not after that, these are the, for 10 days of the Jwara, you can go for this. Yushaihi, Amlaihi, Anamlaihi va, Jangalairva Rasaihita. You can go for the Yusha Prayoga. You can go for the Mamsarasa Prayoga, that is Jangala Mamsarasa Prayoga, for 10 days. Dashaham Yavadashniyat Lagavam Jwarashante. For the 10 days, this will be the diet that you are advising to the patient. In case if there is a Kafadosha, which is aggravated, and in case of Tikshnagni, go for Yusha. In case if it is a Vata dosha Visheshan, and if the patient is having Durbalagni, go for this Jangala Mamsaras. Well, and then next case, so now you have, in the 10 days, you would have crossed the Taruna Jwara Avastha. The next is after 10 days, that is when the patient is in the Jirna Jwara Avastha. Then Jirna Jwara Avastha, in the sense the patient would have reached the Nirama stage of Jwara. Once the patient attains the Nirama stage of Jwara, that is Ataha Urdhvam, after 10 days, Kafe Mande Vata Pittotare Jware. In case of the Manda Kafa Avastha and in case of the Vata Pittotara Jwara, the Kafa should be Manda and it should be Vata Pittotare Jware. There should be the Vata as well as the Pitta if it is aggravated. Paripakveshu dosheshu sarpipanam tatamratam. So after 10 days, you can go for the sarpipana in the patient, confirming that the kapha is in the mandavastha and it is a vata pittotara jwara. Once the doshas have undergone the paripakva, then you can advise the sarpipana in jwara. You can advise the sarpipana in jwara. Till this I mean, if the patient has not attained this phase, that is Kaphamanda and Vata Pittotara Avastha, you cannot go for the Sarpipana. If the patient is in the Sama stage itself, then Kashaya should be continued. Okay, only if the patient attains the Paripakvesha dosheshu, Kafe Mande, Vata Pittotare Jware, you can go for the Sarpipana in the patient. So Sarpipana here again says that you cannot go for the Anuvasana and Abhyanga, it is only the Sarpipana. So in some of the conditions of the Jwara, you need not wait for the 10 days of the Jirna Jwara Avastha to administer the Sarpipana. Sarpipana is advised from the initial days itself in case of few types of Jwara like Visarpena, if it is caused by Visarpa, or Abhigatena in case of the Abhigata Jwara, and in case of the Vispotakai Jwara, you can go for the Sarpipana in the initial stage itself. So what happens in the chronic stage of fever, when the Ruksha Teja is this aggravating in the body, you can go for the Sarpi Prayoga. Okay, and next is about the Kshira Prayoga in Jwara. Daha Trishna Paritasya Vata Pittotaram Jwaram Baddha Prachyuta Dosha Vaniramam Payasa Jayet. If the patient is having Daha as well as the Trishna, if he is suffering from Daha and Trishna, and if the doshi condition is Vata Pitta aggravation and Baddha Prachyuta Dosham, if there is a Baddha dosha or if it is a Prachyuta dosha, it is again the contrary, it is opposite. If it is a Baddha dosha, for Saranartha you need the Kshira Prayoga. If it is a Prachyuta dosha, if it is diarrhea like condition, for Sangrahanartha, for stopping the diarrhea, you need to give the Kshira. Niramam Payasa Jayat. The patient should be in the Nirama Avastha. So if it holds this, if it holds this the condition, that is Daha Trishna Paritasya, the patient, if he is having the Daha and Trishna, in case of the Vata Pittotara Jwara, and in case of the Baddha Prachyuta Dosha, in case of the Baddha Dosha as well as the Prachyuta Dosha, Niramam, and the patient should be in the Nirama Avastha to go for the Kshira Prayoga. For Kshira Prayoga can be done. So Kshira here, how to advise the Kshira? You can boil the Kshira with Panchamuli Kshrutapaya you can advise, or Daroshnapaya. Daroshnapaya, this is as it is collected from the Addar, you can go. Ushnam Sheetamba. In case if it is a Vata which is aggravated, go for the Ushna Kshira. If it is a Pitta which is aggravated, go for the Shita Kshira. And after that, after Kshira Prayoga, again advise the Bala in the patient. In case of Akshina Bala Mamsa, if the patient's strength is optimum, go for Vamana or Virechana. If the patient is Kshina, if he doesn't have the strength, go for the Niruha Basti. Jwara Kshinasya Nahitam Vamana Virechana. If in case if the patient is having strength, he can go for Vamana and Virechana. If the patient doesn't have the strength, Jwara Kshinasya, if he is debilitated of the fever, if he is not fit for Vamana and Virechana, Kamam tu Payasatasya Niruhairva Harenmala, you can go for the Niruha Basti. And next, after that, Purana Jwara Chikitsa. This is the Purana Jwara Chikitsa. Jware Purane Sankshine Kafapitte Dridagnaye Rukshabadda Purishaya Pradatyad Anuvasanam. Jware Purane. That is, in case of the Purana Jwara, Sankshine Kafapitte. If the Kapha as well as the Pitta is in the Kshina Avastha, in case of the Dridagnaye, if the Agni is strong, in case if the patient is having Ruksha and Ruksha Baddha Purishaya, Pradadyad Anuvasanam, you can go for the Anuvasana Basti. One thing. And also there is an indication for Murdra Virechana, that is Nasya. If the patient is having Gaurave Shirase, if he is having heaviness in the Shiras, Shule, if there is pain, Vibaddeshu Indriyeshu cha, if there is no clarity in the Indriyas, in case of the Jirna Jwara, you can go for the Nasya Prayoga. These are the two chikitsas which is also mentioned in Purana Jwara. And next is Bahirmargagata Jwara. Bahirmargagata Jwara in the sense if the Jwaras are present in the Shakas, Abhyangascha, Pradehascha, Parishekascha, Avagahane. You can go for the Abhyanga or Pradeha or Parisheka. Can be advised. So, and one more thing is continuing with that, with the Jwara, there is some things. The next important question is the Sannipataja Jwara Chikitsa. Samsarga as well as the Sannipataja Jwara Chikitsa. So here, Samsrishtan Sannipatan Buddhva Taratamaihi Samaihi Jwaran Doshakramaapekshi Yatoktaihi Aushadaihi Jwarat. If in case of the Samsrishta as well as the Sannipataja Jwara, if it is a Samsrishta Jwara, depending upon the doshik visheshan, go for the chikitsa. And next line, Vardhanena Ekadoshasya Kshapanena Uchritasya va Kafasthananupurva va Sannipata Jwaram Jayet. This is the Chikitsa Sutra which is said for Sannipata Jwaram. Okay, so in two lines, you know, in case if it is a Sannipata, there can be Sama Sannipata and Vishama Sannipata. The first line is for the Vishama Sannipata. Vishama Sannipata here, Vardhanena Ekadoshasya Kshapanena Uchritasya va. If in case of one dosha which is least aggravated, the other dosha, other two doshas, if it is highly aggravated, like for example, take an example of Vata as well as the Pitta dosha which is highly aggravated and Kapha which is in lesser degree which is aggravated. Vardhanena Ekadoshasya, the one dosha, the Kapha, in this example, the one dosha which has undergone the least aggravation should be Vardhan, that should be aggravated. Shapanena Uchritasyava, the two doshas which have undergone the Uchrita avasa should be elevated. So, in case if it is a Vata Pitta highly aggravated and Kapha which is least aggravated, in this case you can go for the advising the Madhura Ahara Dravyas. So by advising the Madhura Ahara Dravyas, the Madhura Rasa Prayoga, the Vata as well as the Pitta can be elevated and the Kapha can be aggravated. That says Vardhanena Ekadoshasya Kshapanena Uchritasya va. This can be adopted. And in case of the Samasannipata Jwara, Kafasthananupurva va Sannipata Jwaram Jayet. That is in case of the this Kafasthananupurva. In case if it is a Samasannipata, that is Vata, Pitta and Kapha is equally aggravated, then there is no question of increasing one dosha and decreasing the other two doshas. Why? Because it is on the same level. Then you have to concentrate on the Kafasthananupurva, the origin of the disease. The Kafasthana has to be treated. That is Amashaya should be treated. Then go for the Langana and Pachana Jwara. This is about the Sannipata Jwara Chikitsa. And next the Shakanuswari Jwara. Shita Ushna Snigdha Ruksha Dehi Jwaro Yasya Na Shamyati. You have advised for the Shita Jwara Chikitsa, Ushna Jwara Chikitsa, Snigdha line of management, Ruksha line of management. By adopting all these chikitsas, if the fever has not come down in the patient, then understand it as Shakanusari Jwara, and then understanding it as Shakanusari Jwara, that it is in the Shaka, then what treatment you have to adopt here? It is the Raktavasechana. So the Shakanusari Jwara, you have to adopt the Raktavasechana. And next, Vishama Jwara Chikitsa. Here Tritiyaka and Chaturtaka Jwara Chikitsa. So Karma Sadharanam Jaya Tritiyaka Chaturtakau Agantu Anubandhohi Prayasho Vishama Jwara. So in case of the Vishama Jwara, it is mainly because of the Agantuja Karanas. So that is why the normal treatment protocol is not adopted here. You need a special line of management. So here, what is the special line of management? Vata Pradhanam Sarpibihi Bastibihi Sa Anuvasanaihi Snigdha Ushnaihi Annapanesha Shamayet Vishama Jwara. So in case if it is a Vata Pradhana, go for Sarpi, Basti, Anuvasana, and Snigdha Ushna Annapana can be advised. In case if it is a Pittotaram, Virechanena Payasa Sarpisha Samskritena cha Vishamam tikta shitaischa jwaram pittotaram jayet. In case if it is a pittottara jwara, virechana has to be advised. Virechanena payasa sarpisha samskritena va. And then tiktakshita should be advised. In case if it is a kafottara jwara, vamanam pachanam ruksham annapanam vilanganam. In case if it is a kafaja, then advice for vamana, pachana and ruksha annapana as well as vilangana chikisa, langana chikisa. Kashayanam va cha vishamejware shastam kafottara and advice for the kashaya prayoga. This is depending upon the doshas. There is also mentioning of the Daiva Vyapashaya Chikitsa in Vishamajwana, saying Vishnu Sahasranama is advised. And Somam Sa Anucharam Devam Sa Matriganam Ishwaram. So Ishwara has to be worshipped. Pujayan Prayataha Shigram Munchate Vishamajwarat Vishnu Sahasramurdena. So Vishnu Sahasranama is advised in case of the Vishamajwara. And next, Dhatugata Jwara Chikitsa. So here, Jware Rasaste, Vamanam Upavasam Chakarayat. If it is a Rasa Dhatugata Jwara, go for Vamana and Upavasa. Seka Pradeho Raktaste, Tata Samshamanani cha. If it is a Rakta Dhatugata Jwara, go for Seka and Pradeha. Virechana Sa Upavasam, Mamsa Medastite Hitam. If it is a Mamsa as well as the Medogata Jwara, go for Virechana and Upavasa. Asti Majjagate Deya Niruha Sa Anuvasana. In case if it is Asti Majjagata Jwara, go for Niruha and Anuvasana. This is the Dhatugata Jwara Chikitsa. And next the Agantuja Jwara Chikitsa. Shapa Abhicharat Bhutanam Abhishangascha Yojuraha Daiva Vyapashayam Tatra Sarvam Aushadam Ishyate. So the Agantuja Jwara Chikitsa can be due to Abhishapa, Abhichara, Abhibhutana, Abhishangascha Yojvara. So in case you need the Daiva Vyapashaya Chikitsa here. Abhigata Jwaro Nashet Pana Abhyangena Sarpishaha. Raktavasekaihi Madhyascha Satmehi Mamsarasa Odanehi. In case of the Abhigata Jwara, go for Pana Abhyanga Sarpisha. The Sarpi Pana and Sarpi Abhyanga. You can also go for the Raktavasechana, Madhya and Satmya Mamsa as well as the Odana Prayoga. Kshatanam Vranitanam Chakshatarvana Chikitsa. If it is a Kshata or if the patient is having, because of the Abhigata, if the patient is having Kshata and Vrana, go for the Kshata Vrana Chikitsa. Ashwasanena Ishtalabena Vayoho Prashamanena cha Harshaneshcha Shamamyanti Kama Shoka Baya Jwaraha. If it is a Kamaja Shokaja Bayaja Jwara. Okay, so here Ashwasanena Ishtalabena Vayoho Prashamanena cha. That means Ashwasanena, the patient has to be consoled. Ishtalabena, the patient has to be given with the articles which he is liking for. And also Vayoho Prashamanena, go for the Vata Prashamana Chikitsa and also Harshana Chikitsa. In case of the Kama Shoka Bayaja Jwara. Kamyehi Artena Manojnesha Pittagnesha Upakramehi Sadvakyesha Shamamyati Jwaraha Krodha Samuttitaha. If it is because of the Krodhaja Jwara, Kamyehi Artehi Manojnesha. The patient has to be given with the articles which he is fond of, which he is desiring of. Manojnya, which is pleasing for him. The articles which is pleasing for him should be given. And also the patient should be advised with the Pittahara Upakramas. Sadvakya. The patient has to be advised with Sadvakyas and this will cure the Krodhaja Jwara. Kamat Krodhajvarunasham Krodat Kama Samudbhavaha Yati Tabyam Upabyam cha Bhaya Shoka Samudditaha. So Kamat Krodhajvarunasham Krodat Kama Samudbhavaha. So if the Jwara is caused by Kama, then Krodha has to be induced in the patient and vice versa. This will be a line of treatment in case of the Agantuja Jwara. Yeah. And next is Raktapitta again. Yeah, in case of the Raktapitta, the first thing is Akshina Balamamsasya Raktapittam Yadashnataha. Tad dosha dushtimutklishtam na adau stambanam arhati. So in case of the Raktapitta, in the initial phase, as it is having the tendency, as the Dushita Rakta is having the tendency to come out, you should not go for this stambana chikitsa. Na adau stambana arhati. In case if the patient is akshina bala mamsa, if he is having the very good mamsa as well as the bala, if he is in optimum stage of mamsa as well as the bala, then in the initial phase, as the doshas is having the tendency to come out, you should not advise for this stambana chikitsa in the initial phase. If stambana is advised in the initial phase, then that will lead to some complication. If you arrest the bleeding, if you advise for stambana chikitsa, it will lead to the complications like galagraha, murcha, putinasa, gulma, pliha, anaha, kilasa, mutrakrishna, ashras, visarpa, and bakandara. That is why do not adopt for the stambana chikitsa in the initial phase. And prayena hi samutklishtam amadosha sharirinam vriddhim prayati pittasrak tasmat langanamaditha. Margav doshanubandham cha nidanam prasamikshya cha langanam raktapittadav tarpanam prayojayat. Okay, fine. We should not advise the stambana prayoga in the initial stage of the raktapitta. Then what do we have to advise? Here is the answer. Prayena hi samutklishtam amadosha sharirinam. So as there is a association of ama, vriddhim prayati pittasrak. So because of the association of the ama, there is still worsening, or there will be the chance of further aggravation of the pitta as well as the asrak. That is why you have to go for the langana as the first line of marriage. Tasmat langyamaditaha. So before going for the treatment, margav doshanubandham cha nidanam prasamikshya cha. You have to analyze the marga of the Raktapitta, whether it is a Urdhvaga Raktapitta or Adhoga Raktapitta. Doshanubandham, that is whether it is a Vatanubandha Raktapitta or whether it is a Kafanubandha Raktapitta. Cha nidanam. Nidana, whether it is a snigdha ushna nidana or whether it is a ruksha ushna nidana. These three things has to be analyzed. Marga, that is Urdhvaga Raktapitta as well as the Adhoga Raktapitta. Doshanubandha here refers to Vatanubandha. Vatanubandha will lead to the Adhoga Raktapitta. Kafanubandha will lead to the Urdhvaga Raktapitta. Cha Nidana. Nidanas are again of two types in Raktapitta. One is Snigdha Ushna Nidana. Snigdha Ushna Nidana will cause the Urdhvaga Raktapitta. And Ruksha Ushna Nidanas will lead to the Adhoga Raktapitta. This has to be analyzed. After analyzing that, Langanam Raktapittadav Tarpadampa Prayojayat, you can go for the further line of management. If it is a Urdhvaga Raktapitta Chikitsa, if it is a Urdhvaga Raktapitta, if it is a Sama Pitta Avastha, and if the Nidana is Snigdha and Ushna Nidana, go for Langana line of management with the Laja Saktu and Saktu Tarpana. In other cases in the sense, if it is a Adho Margagata Raktapitta, if it is a Vatanubandhaja Raktapitta, if it is a Pakwa Pitta Avastha, and if it is a Ruksha Ushna Nidana, go for Tarpana. Go for the Tarpana line of management. And again it says, in case of Raktapitta, if it is a Urdhvaga Raktapitta, go for Tarpana Chikitsa. If it is a Adhoga Raktapitta, go for Peya Chikitsa. If it is a Urdhvaga Raktapitta, go for Tarpana Chikitsa. Tarpana Chikitsa can be advised with Karjura, Mridvika, Madhuka and Parushaka. If the patient is having Amla Priti, if he is more desiring of the Amla Rasas, add with Dadima and Amalak. Tarpanam, Urdhvage Tarpanam Purvam, Peya Purvam Adogate. Kala Satmyana Bandhajno, Dadyat Prakriti, kalpavit. And you can also advise Supa Prayoga in case of the Raktapitta. Kafanuge Yushasakam. In case if it is a Kafanuga, go with the soup preparations of Yushasaka, that is vegetables. Dadyat Vatanuge Rasam. In case if it is a Vataja, then go for the soup of the meat. That is the Dadyat Vatanuge Rasam, the meat soup can be advised. So Raktapitta, if it is associated with Kapha, go for Yushasaka. If it is associated with Vata, go for Mamsarasa. If there is some Avastika line of management which is said, if the patient of Raktapitta complains with the constipation, go for Shashamamsa with Vasuka. Vasuka here is Raktapittagna and Shashamamsa is having Kashaya Rasa. And if there is an aggravation of Vata, go for Titiri Mamsa along with Udumbara or Kukuta Mamsa along with the Udumbara. If the patient is having Trishna in case of the Raktapitta, Tikta Dravya Siddha Jala can be advised, or Falodaka can be advised, or the Shita Jala can be advised. This is the treatment. And next is Shodhana in case of the Raktapitta, in whom the Shodhana is advised in case of the Raktapitta. See, you have heard about Shodhana in Raktapitta, like in case of the Urdhvaga Raktapitta, Virechana is advised. In case of the Adhoga Raktapitta, Vamana is advised. That is called as the Pratimargaharana Chikitsa. So the requisitions to go for the Shodhana is Akshina Balamamsasya Yasya Santarpanotitam. In case if the patient is having Akshina Balamamsa, if the strength is optimum, and if the Raktapitta is caused by Santarpana Nidanas, Yasya Santarpanotitam. Bahudosham, if it is having the Bahudoshas, Balavata, if the patient is Balavan, Raktapittam Sharirinaha, if in these cases, Kale Samshodhanarhasya Taddaner Nirupadravam. Virechana Urdhvabhagam Adobhagam Amaninacha. So in these conditions, you can go for the Shodhana in Raktapitta. What Shodhana to be advised? Virechanena Urdhvabhagam. In case of the Urdhvaga Raktapitta, go for Virechana. With the combinations for Virechana are Trivrit Abhaya, Tivrit and Aragvada Phala, Trayamana, Gavakshi, Mulaka and Amalaki. If in case of the Adhoga Raktapitta, Vamana can be advised. Vamana with Madana Phala Pippali, Manta, Madhu, Sharkara, Jala, etc. And see, if you see these two shlokas, they are quite opposite to each other. The first one is where the Shodhana is advised, and the second set of lines are where Shamana to be advised. In case if the patient is having Bala, Mamsa, Parikshena, if there is no Bala in the patient, if there is Mamsa Kshena in the patient, and if the patient is having Shoka, Bara, Advakarshitam, Shoka, and also if he is tired or if he is exhausted by Bara as well as the Advakashitam. Jwalanaditya Santaptam, if he is exhausted under the sunlight, Samtaptam. Anirva Kshinam Amai, if he is exhausted by some other diseases. In case of the Garbini, pregnant women, in case of the old person, or in case of the young person, Staviram Balam. Ruksha Alpa Pramitashanam, if he is having the Ruksha Aharas, or Alpa Aharas, or Pramitashanas. All these cases are not indicated for Shodhana. Avamyam Avirecham, in case if the patient is not fit for Vamana and Vinechana. Vayam Pashet Raktapittinam. In those cases, you cannot go for the Shodhana line of treatment. Instead, Shamana will be ideal. Shoshena Sanubandham. Also, in case if it is associated with the Rajakshma, if Raktapitta is associated with Rajakshma, in those cases, you cannot go for the Shodhana line of management. You should go for the Shamana line of management. That is, Shamana, you can go for the Kashaya Prayoga. If it does not subside, then understand that even by if you prescribe the Kashaya Prayoga, if the Raktapitta has not come down, then understand there is association of Vayu, then go for the Chagapaya. Chagapaya or Gavya Kshira can be advised. Gavya Kshira, whenever you are advising, you should advise with Panchaguna Jalashuddha, this Gavya Kshira added with the Madhu and Sharkara. Or you can also boil it with the Vidari Gandhadi Ganashruta or Bala or Gokshura. And there is few more important question in Raktapitta, like Mutra Margagata Raktapitta Chikitsa. Mutra Margagata Raktapitta Chikitsa. If bleeding is in the Mutra Margas, then this is the combination of drug. That is Shatavari, Gokshura and Chatushparni. Budgaparni, Mashaparni, and this Chatushparni to be advised. This has to be boiled with the Gokshiras. And if it is a Purisha Margagata Raktapitta, if there is a bleeding through the anal orifices, the Gokshira has to be boiled with Mocharasa, or Gokshira has to be boiled with Vatavaroha or Vatashunga, or it has to be boiled with Hibera, Nilotpala and Nagara, and that can be advised. These are two, again, another important questions. And there is one more thing called as the Nasagata Raktapitta. If there is a bleeding through the nose, then what is the line of treatment? Nasagata Raktapitta Chikitsa. So in case of the Nasagata Raktapitta Chikitsa, after Nisrita Dushta Dosha, that is once after the Dushta Dosha is eliminated, then the Chikitsa is you have to advise for the Nasya. And Nasya should be Avapidana Nasya. So what is Avapidana Nasya? Avapidana Nasya is Avapidena, Avapidanascha, Dravyam Apotitam Kritva, Pidayitva, Rasodiyate Yahasa Uchyate. So here the drugs, this has to be squeezed, this has to be pounded, and this has to be squeezed to extract the swarasa, and then it has to be advised for Nasya, that is Avapidana Nasya. With what the Avapidana Nasya is advised? Kshirasya. Kshira can be given as the Avapidana Nasya, or Durva Swarasasya. The Durva Swarasa can be advised, or Yavasa Mulani can be advised, or Palandu Mulanasya can be advised. The onions, Palandu Mulanasya can be advised, or Dadima Pushpatoya can be advised. The juice of the Dadima flower can be advised. So this is the Nasa Margagata Raktapitta. This completes the Raktapitta chapter. Shall I continue with the next disease, Vatarakta? Shall I continue with Vatarakta? Srinidhi, shall I continue with Vatarakta?
Yes, ma'am. Yes, ma'am. Sorry.
Yeah. Okay. Next. Yeah. Vatarakta here. Yeah, Vatarakta here. One more important chapter. So in case of the Vatarakta, it is always advised to go for the Rakta Mokshana. Rakta Margam Nihantyashu Shaka Sandishu Marutaha Nivishyam Anyonyamavarya Vedanabihi Haredasun Tatra Munchedasrak Shringa Jalauka Suchi Alabubihi. So as the Rakta Marga, there is obstruction to the Rakta Marga. Saka Sandishu Marutaha. This is called as the Anyonya Avarana. Raktena Vatam Vatena Raktam Avaritha Pati. So as there is a Anyonya Avarana Vedanabihi Haredasun to relieve the pain, Tatra Munched Asrak Shunga Jalauka Suchi Alabubi. You have to go for the Rakta Mokshana. And again, there is a contraindication for Rakta Mokshana saying Angaglanam Natu Sramyam. If the patient is having Angaglani, you should not go for the Rakta Mokshana. Ruksha Sharira, you should not go for the Rakta Mokshana. Vatottare Chayat. In case of the this Vata predominant, you should not go for the Rakta Pitta. If in these cases, if you go for the this Rakta Mokshana, that will end up in complication, like there will be Gambiram Shvayatuhu, there will be Stamba, there will be Kampa, there will be Snayu, Sira, Amaya, there will be Glani as well as Sankocha. All these are the complications of Raktapitta. So excluding this condition, in other cases, go for the Rakta Mokshana. The next question is how to go for the Rakta Mokshana. There are certain symptoms here. If these symptoms are present, you have to go with Rakta Mokshana with this particular instrument only. If the patient is having supti, numbness, if there is kandu, itching, or if there is a chumuchumayana, tingling sensation, go for the Rakta Mokshana with Shringa. If the patient is having pain, if the patient is having daha, burning sensation, shoe again pain, the pricking sensation, in that cases go for the Rakta Mokshana with Jalauka. If there is desha mrajed, if the pain is moving from one part of the body to the other, go for the Rakta Mokshana with Suchi and Prachana. So this is how you have to plan for the Rakta Mokshana in case of the Vatarakta. We can go for Shringa, Alabu, Jalauka or Suchi depending upon the symptoms. And see that it will not end up in Atiyoga. If there is Atiyoga of the Rakta Mokshana, it will end up in Kanja, Vataroga and Mrityu. And next is about the Virechana in Raktapitta. Virecha Snehayitva Adav Snehayuktaihi Virechanahi. So Virechana here should be advised after the Snehana and Rukshaiva Mrudubihi Shastam Asakrit Basti Karmacha Seka Abhyanga Pradehan Snehihi Prayo Avidahinaha Vatarakte Prashasyate. This is a Chikitsa Sutra. The Snehana followed by Virechana to be advised, and Virechana should always be the Mrudu Virechana. Why? Because if you advise for Tikshna Virechana, that will be contraindicated as Vatak Shobhadyatra Tikshna Virechana Nishedayate. This will further this aggravate the Vata dosha. That is why the Tikshna Shodhana is a contraindication. So then see the patient. If he is a Nati Snigdha Purusha, go for Snigdha Virechana. If he is a Ati Snigdha Purusha, go for Ruksha Virechana. So this is how you have to select. You have to go for the Snigdha Virechana or Ruksha Virechana. If he is a Nati Snigdha Purusha, go for Snigdha Virechana. If he is a Ati Snigdha Purusha, go for Ruksha Virechana. Yes, and then Basti Karma is advised in the patient. Basti Karma is considered as the best line of treatment in case of the Vatarakta. You can go for the Kshira Basti here. And next, there is a shloka which is saying about the separate line of treatment for Uttana Vatarakta as well as the Gambhira Vatarakta. If it is a Uttana Vatarakta, go for Bahya Chikitsas like Alepana, Abhyanga, Parisheka and Upanaha. Bahya, Alepana, Abhyanga, Parisheka, Upanahanahi. If it is a Gambhira Vatarakta, go for Vireka, Astapana, Snehapanaihi, Gambhiram Acharit. If he is a Gambhira Vatarakta, go for Virechana, Astapana Basti and Snehapana. This is what the Chikitsa is separate for Uttana and Gambhira. And next, depending upon the doshik vitiation, there is 3 types of Vatarakta. Vatolbana Vatarakta, Raktolbana or Pittolbana Vatarakta and Kafolbana Vatarakta. The treatment is given separately. In case of the Vatolbana Vatarakta, Sarpihi Taila, Vasa Majja Pana, Abhyanjana Bastivihi, Sukoshnaihi Upanahasya, Vatotara Mupacharit. If it is a Vatotara Vatarakta, then you can go for the Sarpi, Taila, Vasa, Majjapana and Abhyanjana as well as the Basti. And Sukoshnaihi Upanahasya. The Upanaha should be advised with the drugs which is having the Sukha Ushnas. Sukoshna Dravyas like Mrudu Payasa, Vikshira or Mamsarasa Vijivanaya Dravyas can be advised. If it is a Raktolbana Vatarakta or Pittolbana Vatarakta, Virechana can be advised. Grita Kshirapanahi, the Grita and Kshirapana can be advised. Sekaihi or Sabastibihi, Seka can be advised, Basti can be advised. Shitaihi Nirvapanaischa api. Nirvapana here refers to ointments, the ointments, which is having the Shita Dravyas can be advised. Raktapittotaram Chayat. Shitaihi Nirvapaneshapi Raktapittotaram Chayat. Next is Kafolbana Raktapitta. If it is a Kafolbana Raktapitta, here Vamanam Mrudu na Atyartam Sneha Sekam Vilanginam Koshna Lepascha Shasyate Vatarakte Kafotare. In case of the Kafolbada Vatarakta, so you can go for the Vamana. Mrudu Vamana can be advised. Snehana and Seka can be advised. Kshara Taila, Gomutra, Marichakvata. All these are the Kapha Haradravyas. Kshara Taila. Gomutra is again the Kapha Haradravyas and Marichakvata is again the Kapha Haradravyas can be advised. And also Vilangana can be advised. Koshna lepascha. So here, if you're advising for ointments or the lepas, it should be koshna. It should be hot. Shasyate vatarakte kafotvare. These are the treatment for kafottara vatarakta. And also, few of the main formulations that has been said, like pinda taila. Pinda taila is having the reference from vatarakta. And also Virechana, for Virechanartha, in case of the Vatarakta, you can go for the Daroshna, that is the milk which is collected from the cow as it is. Mutra yuktam va kshiram doshanalomanam. The Daroshna can be taken along with the Gomutras or Gokshiras that can induce the doshanalomana, or it can be mixed with the Satrivrat It can be advised with the Trivrat Pitta Raktavrata Anila, in case if it is a Pitta Rakta Anila. Or you can go for the Kshirena Eranda Taila mixed with Kshira can also be advised for Pirishna in case of the Vatarakta. Or you can advise the Kashaya Abhayana Magrita Brishtahi Pibenaraha. The Kashaya Abhayana Magrita Brishtam Pibenaraha. Abhayanama Grita Brishtam. This can also be advised in case of the Vatarakta. These are the important things in case of the Vatarakta. And one more important thing is, in case if the Vatarakta is caused by Meda and Kapha Avarana. This is important here. 157th shloka says that if Vatarakta is caused by Meda as well as the Kapha Avarana, Na Adav Shastam Snehana Brahmana. You cannot go for the Snehana as well as the Brahmana line of management. Instead, here, as it is caused by Meda as well as the Kapha Avarana, you have to go for the treatment which reduces the Kapha dosha. Then you can advise for the Vyayama, different types of exercises, Shodhana, Arishta Mutrapanahi Virechanahi. All these are the Kaphahara. Vyayama, Shodhana, Arishta Mutrapanaihi Virechanahi, Takra Abhaya Prayogasha, Kshapayet Kaphamedasi. The Takra as well as the Abhaya Prayoga can be advised in case of the Kaphameda. See, if the Kapha as well as the Meda Avarana is causing the Vatarakta, then this will be the line of treatment. In case if in condition of suppuration, like in case of the Shigrapaka, then Vedana, Shodhana and Ropana is the line of treatment in case of the Vatarakta. And next is Visarpa. Yeah, in case of the Visarpa, this is the Chikitsa Sutra. Langana Ullekanam Shaste Tiktakanam Cha Sevanam Kafastanagate Same Rukshashitaihi Pralepayet. In case if it is a Kafastanagata Visarpa, and if it is a Sama, in case if it is associated with the Ama, in case if it is a Sama, and if it is a Kafastanagata Raktapitta, then understand it as a Urdhvakayagata Visarpa. Why? Because it is a Kafastanagata Visarpa. Then the line of treatment will be Langana, Ullekana and Tiktakanam cha Sevana, and also Rukshashita Pralepana. For external application, you can advise with Ruksha as well as the Shita Dravyas. In case if it is a Pitta Sthanagata Visarpa, and if it is again Sama, Pitta Sthanagate Apyetat Same. Pitta Sthanagata here refers to the Visarpa which is seen in the Madhya Sharira. And if it is associated with Ama, Kuryat Chikisitam, Shonitavasekam. Go for the Raktamokshana. Shonitavaseka or Virechana is advised. In case if it is a Marutashaya Sambhota, that is in case if it is a Pakvashaya, or in case if it is a Adha Shariragata Visarpa, if it is seen in the lower parts of the body, then the Rukshana has to be advised. advised. The Rukshana Chikitsa has to be advised. Raktapittanvaye apyadau snehanam nahitam matam. Even in case of the Vataja Visarpa, thinking always like if it is a Vata, then go for the Snehan. It is not like that in case of the Visarpa. Why? Because in case of the Visarpa, as Rakta as well as the Pitta is invariably involved, hence Snehana is a contraindication. Okay, you have to go for the Virukshana or the Rukshana line of management, even in case of the Vata predominant Marutashaya Sambhuta Raktapitta. Vatolbane Tiktagrita. In case of the Vatolbana Visarpa, go for Tiktagrita. Vaitikecha Prashasyate Lagudoshe. In case of the Pittacha Raktapitta, if it is a Lagudosha, go for Tiktagrita. Tiktagrate, Paitike cha Prashasyate Lagudosha. If it is a Lagudosha, in case of the Pittaja Visarpa, go for Tiktagrita. Mahadoshe Paitike said Virechana. If it is a dosha which is highly aggravated in case of the Pitta, this Pittaja Visarpa, go for Virechana. See here, if in case of the Pittaja Visarpa, if it is Lagudosha, go for Tiktagrita. If it is a Mahadosha, in case of the Pittaja Visarpa, go for Virechana. This is the thing. Nagritam Bahudoshasya Deyam Yanna Virechana. You should never advise a Grita which doesn't cause the Virechana in case of the Visarpa. Always say that whenever you are advising a Grita in case of the Visarpa, that should cause the Virechana. Avirechana Grita is a contraindication. Grita, if you are advising in case of the Visarpa, that should cause the Virechana. In case if it is not causing the Virechana, then it is not indicated in case of the Visarpa. These are the examples for the Virechana. And next is the Rakta Mokshana. As Rakta is the sthana of Visarpa, Rakta Mokshana is indicated. Etastani Sarvani Rakta Mokshanam Ekata. Rakta Mokshana has its own importance in case of the Visarpa. As Rakta is the sthana for the Visarpa, Rakta Mokshana is also having very important place. Shaka Dushte to Rudire. If the periphery is involved, if the Shakas is involved, you can go for the Rakta Mokshana with Shringa Alabu as well as the Jalauka. If it is a Vata Visheshan, go for Shringa. If it is a Pitta Visheshan, go for Jalauka. If it is a Kapha Visheshan, go for Rakta Mokshana with Alabu. Or you can also go for Siravyada. If you did not advise for Rakta Mokshana in case of the Visarpa, that will lead to Tvak Mamsa Snayu Sankleda as well as the Rakta Kleda. And hence, that is why Rakta Mokshana should be indicated to prevent all these complications. And you can also go for the Bahya Chikitsa in Alpadosha. If it is a Tvak Mamsa Ashrita Visarpa, in case if it is a Alpadosha, you can also go for the external line of management. Again, it varies. If it is a Vata Pitta Visarpa, go for Pralepa with Udumbara Pradeha. If it is a Kafaja Visarpa, go for Trifaladya Pradeha Kadiradya Lepa. Here there is examples that is given. If it is a Vata Pitta Visarpa, these are the choices. If it is a Kafaja Visarpa, these are the choices. And there is Dosha Pratyanika Chikitsa again. Kuryat Chikitsita Tasad Shita Prayani Paitike Ruksha Prayani Kafaja Snahikani Amilatmaki. If it is a Pittaja, go for the Shita Prayoga. If it is a Kafaja, go for Ruksha Prayoga. If it is Vataja, go for Sneha Prayoga. This is depending upon the dosha combination. Vata Pitta Prashamani Agni Visarpena Hitam. Agni Visarpa is again because of the Vata as well as the Pitta combination. Go for the Vata Pitta Prashamana. In case if it is Kardama, Kardama is because of the Kapha Pitta combination. That is why Kapha Pitta Prashamana Chikitsa has to be advised. Raktapittotaram Drishtva Granthi Visarpamaditaha. And here in Granthi Visarpa, if it is a Granthi Visarpa, this is the line of treatment. Rukshanaihi, Langanaihi, Seka Pradehaihi, Panchavalkalaihi. Rukshana as well as the Langana can be advised. Seka Pradehaihi, Panchavalkalaihi. That is, Seka with the Kashayas of Panchavalkala can be advised, or pradeha with the kalkas of panchavalkala can be advised in case of the Granthi Visarpa. Seka pradehaihi panchavalkalaihi. Siramoksha can be advised, Jalauka can be advised, Vamana can be advised, Virechana can be advised, Gritaihi Kashaya Tiktaisha Kalajnaha Samapacharet. Grita can be advised, Kashaya Tikta Rasas can be advised in case of the Granthi Visarpa. So after the Urdhva and Adha Shodhana and the Rakta Mokshana in case of the Granthi Visarpa, the patient has to be advised with the Vata Shleshmahara karma, Vata Shleshmahara chikitsa has to be advised. In case if the patient is having Shula, Upanaha can be advised. Upanaha here is the lepa with the Ushna Dravyas, Ushno Bahulo lepaha. You can advise Upanaha with Utkarika or Veshavara. And then Parisheka can be advised. Parisheka with Dashamula Siddha Taila Sechana can be advised, or Kushta Taila Ushna Seka can be advised, or Pakyakshara Seka can also be advised. In case if it is a Dirgha Kalina Granthi, Visarpa, if it is a Dirgha Kalina, then Bedanat can be advised. You can incise it and treat it. If it is Pashana Katina, if it is stony hard, and if it is not coming, if it is not relieved by any of the other line of treatment, then cauterization or Dahana Karma can be advised with the Kshara, Shara or Him. And Pakabihi Pachayitva va Patayitva Samupacharit. After Paka, it should be incised and removed, and then the external measure to be given. And also, there is an indication of Duma, Shiro Virechana, Sweda, and Parimardana in case of the Visarpa. And in case of the Galaganda, Granthi Visarpa was the treatment to be advised. So, if they ask about the Galaganda line of treatment, the Granthi Visarpa line of treatment can be advised in the patient. This is about the Visarpa. And next is kushta. Yeah, kushta here is Vatottareshu sarpihi vamanam shleshmottareshu kushteshu pittottareshu moksho raktasya virechanam cha akriti. This is the Chikitsa Sutra saying that in case of the Vata predominant kushta, sarpi to be advised. In case of the shleshma predominant, vamana should be advised. And in case of the Pittottareshu, in case of the Pittaja kushta, moksho raktasya virechana, rakta mokshana and virechana to be advised. With what to advise for Vamana Virechana? Whatever the drug that is given in Kalpasthana to be taken as a reference. Vamana Virechana Prayogaha Kalpoktaha Kushtinam Prayoktavyaha. And next line, if you observe, it is about whether the kushta is local or whether the kushta is mahati or it is spreaded widely. So if it is alpa kushta, prachanam alpa kushta. If it is alpa kushta, if it is a small lesion, then go for the prachana. Mahati cha shastam siravyadam. If it is widely spread, go for siravyadam. बहुदोषः संशोध्य कुष्ठी बहुशो अनुरक्षता प्राणात् दोषो हि अतिमात्रा वहति वायु नयन्ति बलम आशो. So always if it is a bahudosha avastha, if it is widely spread, go for the rakta mokshana. If it is bahudosha avastha, shodhana is absolutely needed. Snehasya panamishtam shuddham koshte pravahite rakte vayurhi shuddha koshtam kushtam agnibalam vishati shigram. So this simply important is in case of the alpa kushta, go for prachana. In case of the maha kushta, if it is widely spread, go for siravyana. And if it is present in the and actually this if it is doshot klishta hriday, if it is present in the upper part of the body, then vamana is advised with kutaja, madanafala, maduka and patola nimbavarina. And virechana by trivrat, danti, trifala, and this can be advised also. And one more thing is, in case of the kushta, basti is a contraindication. In case of kushta and prameha, basti is a contraindication. Nastapya kushtinaha. It will further aggravate the condition. But there is a reference of basti in case of the kushta, where if it is a vatolpana kushta, then basti can be advised with these drugs. Astapana basti with Darvi, Brihati, Sevya, Patola, Madana, Kritamala, Kalinga, etc. can be advised. And Anuvasana can also be advised, but strictly with the drugs which is mentioned here. Nasya is also mentioned in case of the kushta, like Nasya can be advised with Saindava, Danti, Maricha, Faninchaka, etc. Vairechnika Dhumapana can also be advised in case if there is a krimi, kushta, kilasa in Uttamangas. And next is, this is most important, the treatment of kushta depending upon its morphology. This is very, very important. In case if the kushta is stira, katina, mandala kushta, if it is stira, if it is katina, if it is hard, or mandala kushta, if it is round, then what you have to do? You have to go for the prastara and nadi sweda. After prastara and nadi sweda, go for kurchahi vigatana, rub it with the kurcha shastra. This is depending upon the morphology. And again, at another condition, utsana kushta, if it is elevated. It is elevated, but it is not having the peduncle. In that case, in case of the Ussanna Kushta, the Svedana has to be advised with Sukoshna Pottali of Anupavarija Mamsa, and then Lekana to be advised with the Tikshna Shastras. If it is a Kapha Kushta, particularly if it is a Alpa Kushta, if it is a Kapha Kushta and if it is not widely spread and if it is very localized, then go for the Prachana Chikitsa. Followed by the Prachana Chikitsa, go for Rakta Mokshana, Vaishunga, Alabu, and Janauka. So after Vamana Virechanadi, after Shodhana, and also after Rakta Mokshana, Lepa should be advised. It is a very strict notification. Only after Vamana, Virechana, and Rakta Mokshana, the Lepa should be advised. E lepaha kushinaha yujyate nirhata asradoshan samshodita ashayanam sadhyaha siddhir bhavati. So only after Vamana Virechana and Rakta Mokshana, if Lefa is advised in the patient, that will lead to the fruitful thing. So, in case if the patient cannot go for the Shastrakarma, if you cannot advise for Prachana, or if you cannot advise Rakta Mokshana, Vishunga, Labu, and Jalauka, or if there is a Spashendriya Nashanani, if there is numbness in the lesions, then what is the line of treatment? Rakta Dosha, Visravana to be advised by Shringa, Labu, and Jalauka, and then followed by Kshara application to be given. One more condition, if it is a Pashana Katina Purusha, Pashana Katina in the sense if it is stony hard, if it is rough Purusha, if it is Supta, numbness, if it is Tira and Purana Kushta in case of chronic condition, there is reference of Pita Agada, the Vishadravya should be given for drinking, and also the Vishadravyas, Visha Agada Pradeha is advised only if it is a Pashana Katina, Purusha, Supta, Stira, and Purana Kushta. If it is a Stabdani, Supta, Na Svedana Kandu. If it is Stabdani, and if it is Supta, Na Svedana, if there is no perspiration, and if there is Kandu, then Garshana to be advised with the Kurcha, Danti, and Triprit. And also there are some other drugs which can be advised for Pradeha. Simply is after the doshic wise management of kushta, you always should remember that the chikitsa is given as per the morphology of the kushta, as whether it is a stira katina mandala kushta, or if it is a usana kushta, or if it is kapha kushta, or if it is a pashana katina parusha kushta or stabdani kushtas. This is how the kushta is done, and there are few other important points also in case of the kushta, where uh, the in case if it is a twak prapta, depending upon that is dhatugata kushta chikitsa. In case if it is a twak prapta, shodhana alepana to be advised. In case if it is a shonita prapta, shodhana alepana kashayapana shonita avasechana to be advised. In case if it is a mamsagata kushta, shodhana alepana kashayapana shonita avasechana arishtamanta prachara to be advised. Like this, there is the Dhatugata Kushta Chikitsa to be, Dhatugata Kushta Chikitsa is having the reference. And also one more important thing is Punaha Punaha Shodhana in Kushta. Pakshat Chardanam Abhyupeya. Once in 15 days, the Vamana to be advised. Masan Sramsanam Chapideyam. Once in a month, Virechana to be advised. Sravyam Raktam Vastarehi Dviralpam. In a year, 2 times go for the Rakta Mokshana. Nasyam Dadyat Triratram Triratrat. Once in 3 days, go for the Nasya Prayoga. First, select which doshic variety the kushta is, and then if the patient is fit for vamana, once in 15 days vamana to be advised. If the patient is fit for virechana, once in a month virechana to be advised. If the patient is fit for rakta mokshana, twice in a year rakta mokshana to be advised. If the patient is fit for nasya, 3 days once the nasya to be advised. It is not like all the treatment we have to give in a single patient. Depending upon the need, we have to go for the shodhana chikitsa. And then Shvitra Prayoga treatment again, it is said that Shvitram Sramsana treatment to be advised with Malapu Rasa, Kaka Udumbara. Kaka Udumbara with Guda to be advised. Here what you have to do? Stam Pitva Susnigdo Yatabalam Suryapada Santapam. After advising the Malapu Rasa with Guda, the patient has to stand under sunlight for certain duration, and this will cause the virechana. That is what it is advised. If the patient is having Shvitre Angeyo Spota, if there is a spota or vesicle formation in the Svitra, that has to be Kantakena Tambindya, it has to be incised, it has to be Spoteshu Visrateshu, the discharge has to be taken out, and then it has to be treated as a Vrana. The main important thing is here Shvitra, the Malapurasa Ishyate Sagudaha, the Malapurasa is advised for Sramsana, the Malapurasa along with the Guda to be advised for Sramsana. Yeah. And the last one, the Madatyaya. I'll brief it out and conclude this. The Madatyaya here. Yeah. Sarvam Madatyaya Vidyat Tridosham Adhikam Tutam. So all the Madatyas are Tridoshaja. Dosham Madate Paschet Tasya Adav Pratikarayat Kafastu Nastana Anupurvya Chakriya Karya Madate. See here the Kafastana Chikitsa, Kafastana Anupurva Chikitsa to be advised. The same treatment is advised in Samasannipataja Jwara Chikitsa if you remember. So Kafastana Anupurva Chikitsa, the Kafastana, that is Amashaya to be treated, and then go for the Pitta as well as the Pata. Kafastana Anupurva Chakriya Karya Madate. Pitta Maruta Paryantaha Prayana hi Madate, and then go for the Pitta as well as the Maruta Chikitsa. Mitya Atihina Pitena Yo Vyadihi Upachayate Samapitena Teneva Na Madhyenopa Shamyate. So always in case of the Madate, we have the reference of treating the Madate with Madhya itself. In case if it is a Anna Prakangshaha, Madhya with Saindava Lamana Vida should be given. In case of the Vataja Madate, Doshena Ruddaha Srotasu Marutaha. For in case of the Vataja Madate, for Dosha Vishyandanartha and Vartanulomana, Madhya to be advised. For Pittaja Madateya, Amashe Mutklishtam Kafa Pitta Madate, Vamana to be advised. Vamaye Shigrameva. Vamana to be advised in case of the Pittaja Madateya. And Trishna Daksharasam Patu Shitam Doshanulomanam. In case if the patient is having Trishna, go for the Doshanulomana Chikitsa. You can also advise for the Draksharasa. And yeah, in case if it is a Kafaja Madateya, Kafa which is aggravated, then Ullekana. Ullekana is Sadyavamana to be advised and Upavasa to be advised. You can also advise Savarchala, Ajaji, Javrikshamla, Amlavetasa. These are the other drugs that can be advised. So Langana, and after that Pachana, after that Dosha Shamana, Dosha Shodhana and Shamana is the protocol. After that, if the patient is having Kafakshina Avastha, if the patient is having Durbalata and Lagavata, Kshira Prayoga to be advised in the patient. The patient has to be advised with the Kshira Prayoga. Kshira Prayogam Madhyam Cha Kramena Alpalpam Acharet. And in case of the Dvamsaka and Vikshaya, the Vatika Madatya Chikitsa to be followed Basti, Sarpishapana, Kshira Sarpishoyoho, Abhyanga, Udvartana, and Vatagna Annapana to be advised. So, this is about the Madatya Chikitsa. Yeah, this completes the things.
Thank you so much, ma'am.
Yeah. Okay.
On behalf of the Panchajanya organization and all the students that are getting benefited out of these sessions, I extend our sincere thanks for taking the time to conduct such a valuable revision session for the students as they prepare for their upcoming examinations. The clear explanations, practical insights, and focused approach not only reinforced their understanding but also boosted their confidence, ma'am. It was a privilege to listen to you, and we are sincerely thankful for the time and effort you have devoted to being with us today. We look forward to future opportunities to learn from you once again, ma'am. Thank you so much, ma'am.
Thank you. Thank you.
Thank you.
Thank you.
Ma'am, I'm ending the session.
Can I end it?